Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Nathaniel Smith is a certified family nurse practitioner and a diplomat of the American College of Lifestyle Medicine, the ACLM. His career in nursing started in 2012 and then advanced to advanced practice in 2016, and then shortly thereafter discovered lifestyle medicine. And his own journey of severe childhood asthma and adverse chronic steroid therapy effects have made him really passionate to use evidence-based intensive therapeutic lifestyle interventions, sometimes called ITLC, interventions such as a whole food, plant predominant nutrition or dietary pattern, intermittent fasting, regular physical activity, restorative sleep, stress management, avoidance of known and potentially harmful substances, and positive social interactions. And of course, some of our favorite, time spent in nature to prevent, treat, and or reverse non-communicable diseases, which are many, right? Hypertension, high cholesterol, autoimmune disease, diabetes, all of these things, type 2 diabetes. And he recently joined the team of True North in Santa Rosa, California, which is a water-only residential facility that provides very high-level support for people who want to embark on a medically supervised water fast with a graduation back to a whole food, plant-exclusive diet that is free of salt, sugar, and fat. And so, Nathaniel, we're really happy to see you. And I also want to mention that in addition to his own personal health transformation, of course, he has been witness to many other people reversing or improving their chronic health conditions. And a lot of these are leading killers in the US. And so you have a really unique and intriguing experience as a nurse practitioner. And we're going to find out even more about you. I'm really glad that you are spending this time with us today and that you have your beautiful lunch that you got from True North that you shared with us.
Likewise, I'm stoked to speak with both of you.
Yes, this will be fun.
And Deborah is my official mentor in all aspects of life, so we'll have to credit her with that too. A lot of my successes, thanks to her.
Yes, she definitely helps uplift many of us, for sure.
Mm-hmm, definitely. Thank you for your positive social connection, Deborah.
They matter. They matter, as we know.
That is, we checked off a pillar there.
Yeah.
And you check it off for me.
So Nathaniel, we want to hear about your role, but before that, we want to hear about your origin story of finding lifestyle medicine. How did you even discover that this was a subspecialty you could get involved in?
Yeah, it all started when I was a kid. Like you mentioned with me, I had severe asthma and I was life flighted to the hospital multiple times. I wore a fanny pack with my albuterol because I could die at any moment having an asthma attack. It was so out of control, and doctors only ever increased my steroids. And it's really sad to think about that, but they did what they knew. But one of my favorite quotes, modified by Dr. Sarai Stancic, is "Know better, do better." So I was on a quest ever since I was little to figure out what's at the root cause of my problem. Why am I always having these asthma attacks? And then eventually, my mom got me out of the conventional healthcare system because obviously it wasn't working. I mean, it kept me alive, so thankful for that. But in the long term, it was costing me a very high price. So my mom pulled me out of the system, and then she took me to a chiropractor, and then which we use chiropractors where I work, and I really appreciate chiropractors. I see them as musculoskeletal experts, and they can actually the one here, I was having a problem, and he fixed me right up. So I do endorse them, as long as they're pretty reputable. And then this chiropractor back in my hometown, he referred my mom to this nurse in Washington State, about 4 hours away from where I lived on the Oregon coast. And we went to her, and then she basically over supplemented me like crazy amounts. And we're talking like this is where we're bridging the lines of functional medicine. Tons of pills, a whole handful, like 2 to 3 times a day. Like I was so full from the pills, I almost didn't eat sometimes. It was crazy. And keep in mind that supplements are not FDA regulated. They've done studies of supplements, and they found sometimes that they don't even have what the label says is in it. And other times, or in addition, there could be toxic substances or even heavy metals in the supplement that is not written on the label. So I'm very cautious with prescribing supplements, and it should only be prescribed if there's a proven deficiency. So anyway, I was over supplemented, but somehow I got better. And could have been the placebo effect, possible, or could have been because the literature says that adolescents often get better on their own. I highly suspect that. But at the time, my parents saw my improvement, and they credited it with the change that they thought that they did seeing this nurse. So then I said, okay, how do I become a nurse? Because we thought that she was the one who fixed me. I did improve. I got off the steroids during that time seeing her. So it was a significant improvement. And then I went to nursing school, and then I grew up very religious. I'm not anymore. I'm a recovered Baptist. But my family shipped me to Pensacola Christian College, and thankfully I made it through. I really had no idea what nursing was, and somehow I passed. Thank goodness. That was actually the hardest thing I've ever done in my entire life, was getting my BSN at Pensacola Christian College. It was very difficult. And then I became a nurse, and I was down in Pensacola for a little bit, worked in a nursing home and a step-down cardiac floor. And then I realized I wanted to continue my career advancement. And I thought, I want to be a provider. So I thought NP would be perfect. So then I got my nurse practitioner online with Chamberlain. And later on, online, I don't necessarily recommend. I don't think it's as good as a brick and mortar. So I sought out more experience. So then I ended up moving across the country from the Pacific Northwest all the way to New Jersey for a neurology fellowship. It was a really neat experience, but I did want more nurse practitioner experience, so that was the perfect way. There are relatively not too many, so it's hard to get into them. So I just finally got into one, then I was able to move and start that. And it was at this fellowship that there was a primary care conference for the local health system, and thankfully I went. And guess who was there? Dr. Joel Furman, presenting either you can take a statin for your high cholesterol with all these known risks, and you're likely going to get myalgias, and it's only going to reduce your cholesterol by so much, or you can eat a diet full of whole plant foods. I like how he described it in a plentiful way. There's greens, beans, onions, and mushrooms, berries, and seeds. And after hearing that, and then he said, in plus, this is highly effective at reducing cholesterol, even more so than a statin, and there's no side effects. Finally, the light bulb clicked after all of these, just imagine, 6.5 years of nursing education. And the only time nursing got it right was when we talked about dark leafy greens being the answer to every NCLEX question. But for me, that's what they told us, and that usually was right. And then number 2 was increasing your water intake. So I remember one time one of my nursing instructors, she said, "How much water do you all drink?" And then I was like, "I don't drink any." So so those are the 2 things that nursing got right. Otherwise, no. So it was excellent to finally hear this, and then I looked into it, and within 1 or 2 years, I did end up getting certified in lifestyle medicine, and I highly recommend that all eligible healthcare professionals do get certified in lifestyle medicine to show that you did meet the standards to prescribe lifestyle medicine. And plus, you get to join this amazing network of other lifestyle medicine-oriented individuals. And that is the bulk of my story.
Okay.
How lifestyle medicine came to be.
So you just happened to go to the right conference at the right time and heard the right person and
wow,
found the right.
And the key is I was ripe and ready for the information.
Yes.
If you had presented that to me at another time in life, maybe I wouldn't have perked up. Oh, and I want to say one more thing at that conference, because I was sold, but not 100%. I told myself, I need to watch this guy eat at lunch, because that lunch thing doesn't really match what he was saying. So I got a seat somewhere next to the line, and I watched him like a hawk. And I thought, I'm watching this Dr. Furman. If he does what he says, I'll do it. And then I watched him. He only grabbed the raw leafy greens, and he did grab the whole plant foods that was there, and didn't have any of the chicken or the whatever other processed foods was there. That's what sold me. And I told him at this recent conference at the NHA where Deborah came too. And I did tell Dr. Furman that I did that.
That's funny. What did he say? Did he say anything?
Oh, he smiled. I don't think he really said very much,
right.
but he just thought that it was funny.
Yeah. So tell us what you're doing now, because you had mentioned True North a little bit, and I don't know that everyone knows what that is. So tell us about your role and what that facility is.
Sure. Well, so first, maybe I'll back up. Once I discovered lifestyle medicine, I got certified. I knew I had to get a job in lifestyle medicine. So I actually ended up touring the whole country for almost a year, and it was painfully difficult. And it was really hard to find one that would actually pay fair compensation. So it took a long time, and the whole year, and I didn't find anything. I was here in True North in 2018, hoping there was a job, but there wasn't. And I went to Hawaii, I went to Missouri, I went to Delaware, I went everywhere, and I just couldn't find anything. And then finally, I had an offer from Ethos Primary Care out in New Jersey, which I do highly endorse. They are the world's first farm-based healthcare system, where it's a doctor's primary care office where we use lifestyle medicine, and we offer an intensive lifestyle change program. And it's where I learned everything that I know today, thanks to Dr. Ron Weiss's mentorship, who's the founder there. And it's on the setting of an organic veggie farm. And they sell patients in the communities the produce at their doctor's farm market. Really neat place. I was there for about 3 years. I ended up coming back to that offer and taking it. It was just low compensation, but I treated it as like an internship. So I did spend a few years there, and I did really enjoy it, and I learned so much. And then from there, this opportunity came back at True North, the True North Health Center, which I believe was founded, I forget when it was founded, but Dr. Alan Goldhammer, who's a chiropractor in the United States, but I believe he is an osteopathic physician in Australia, and he trained under Dr. Herbert Shelton a long time ago there. And then he came and he developed the True North Health Center here in California, a little south of here. We started at a smaller location, then he moved here to Santa Rosa. And Dr. Joel Furman was actually, I believe, was his first medical intern. So that's how long this goes back. It's amazing how it's all coming back full circle. Even now as I'm saying it, it's pretty wild. How Dr. Joel Furman was the first, my portal of entry, and here he was. He was here where I'm working now, and as the beginning. But so that here at the True North Health Center, like you said, it's a licensed boarding house by technicality, and it's also known as like a residential education, a nutritional, let me get this all right, residential nutrition education program. But I like to think of it as a lifestyle medicine, almost like a hospital, basically. It's the first of its kind. It's absolutely amazing. Patients can come and they may water fast up to 40 days or so. but that's pending an intake and a physical exam with one of our attending providers. And then, or patients can elect to come and just have the food, which I showed you a moment ago. And it's only whole plant foods, and it's SOS free. And I love that they're SOS free. I'm all about SOS free. That is my biggest pet peeve: salt, oil, and refined sugar. I do my best to adhere to these guidelines. And and then patients can stay as long as they want. And it's relatively affordable because patients, they pay for a room within a suite. So they may have like anywhere from 2 to 3 suite mates, and some may share a bathroom and such. So it's Chef AJ even said before that it's cheaper to come stay here than it is to go rent an Airbnb down the street. There's no question, hands down. If I was visiting, I would stay here for a vacation or rent to tour the area. So that's basically what we do. And they have all sorts of, here at True North, we have a research foundation. It's called the True North Research Foundation. And they're always publishing case studies and have a research team, which is so important. I feel bad for lifestyle medicine professionals everywhere because we're doing such great work, and a lot of it's not being published. I think maybe later on, hopefully there's a big publishing department that can assist lifestyle medicine professionals or something. That would be great.
Yes, I agree with that.
For the time being, True North has its own because Dr. Alan Goldhammer recognized that's critical for everyone knowing about what he's doing and his objective data.
And it is part of the nursing process, really. We assess, we create a diagnosis, we intervene, we evaluate, and I also went to a place with a lot of research. I worked there, grew up as a nurse in a very big research facility, and it was like, so I have this thought, same as you, that part is really important.
It's a critical piece. It's underlooked, but it's so, and that's how the medical community communicates with each other. Whether in another country they could publish something like, whoa, mind-blowing, and get the rest of the world to start looking into it, Otherwise, there's no communication. I view it as a big communication tool.
Yes. So what is your role on that team? What do you do? What is a day in the life?
So I was hired as a clinical administrator, and at the moment I'm scheduled, I do rounding shifts on patients. So I'll round in the afternoons. We round on every patient twice a day, morning and afternoon. So I round in the afternoons. I fill in whenever there's a need. So if a medical assistant doesn't show up or calls in, I function as a medical assistant. I go around the facility taking everyone's vital signs. I function as, we have a role called the clinician on duty, and that's during the day in between the rounds. So if anything comes up, it comes through me. So I do that a couple times a week. What else do? I do all sorts of projects. I put the National Health Association magazine into every room, so every patient has access to that. I highly recommend that. $10. Wait, let me think about it. $35 a year, I believe, and you get 4 magazines each year, plus all the other benefits of being a National Health Association member. And they also endorse an SOS-free whole plant food lifestyle. But I do all sorts of projects. I make sure the phones are working. I do anything and everything. And lots of emails.
Right. So what do you see? Can you tell us a little bit about like the patient experience? What are some of the challenges they face? What brought them there? What success have you seen?
Yes. When the patients come, I'll say the process of how it works. So patients, they go online to True North and they book a free consultation with Dr. Goldhammer, and they'll fill out their medical history form intake. Then they get the free screening with Dr. Goldhammer for a 10 or 15-minute talk just to say you're eligible for this or not based off their medications they're taking or their medical diagnoses. And then once that occurs, then they can go to the scheduler, and usually we book anywhere from 3 to 6 months in advance if someone wants to stay in one room the whole time. If someone needs to get in much quicker, they can come sooner often, but they'll have to change rooms throughout their stay. So that's how that works. So they schedule, and then when they do finally arrive, they do a medical intake. So they'll fill out some more forms. They'll see our medical assistant for screening and vital signs. Then they'll meet with our medical concierge. They're basically our hotel management. They check them into the room. They have them sign all the HIPAA documents and the private practice policies. And then they're shown to their room, and then The next day, usually they'll see their attending provider. We have 5 attendings, and I am training to be a cover attending, so that's underway for maybe the holidays. I'm excited about that. And let's see. And then when they have their intake, so they'll just like seeing a normal provider, they'll have an intake. They'll go over past medical history and the past surgical history, social history, the review systems, and the standards, and they'll have a physical exam, and then they'll discuss together what the treatment plan will be, keeping in mind what the patient wants and then what's realistic, and then putting together a plan whether the patient can fast for a week, 2 weeks, 3 weeks, or if they have a significant condition and they have the weight to afford such a long fast, they can do up to 40 days. And then half the time that a patient is in a water fast, so let's say they do the max of 40 days to water fast, they will have to do half of that time refeeding. So 40-day water fast, then 20 days to refeed in each of our 5 phases of our refeed. And patients who come in and they're returning patients and they got this under control with the diet, they can go right away into their water fast oftentimes once they get approval by the attending. But most otherwise, patients should plan to spend at least 2 days eating our foods, because we don't want you to come in eating regular standard American food and then fasting right away. It's like a cliff. We want to gradually get you in with some fiber, have a nice BM, and then start the fasting. So I recommend 2 days of eating for all patients otherwise.
But what kind of emotions do you hear from patients? Do they have, I'm guessing, of course, people that come there have, they drank the Kool-Aid of the SOS-free, whole food, plant-based. Otherwise, maybe they wouldn't even come there in the first place. But even if they embrace that idea, do they still have trouble going back to that diet, or are there emotions involved with this? Tell us a little bit about that.
We're pretty lucky here, and I agree with Dr. Goldhammer that here we get the cream of the crop. We get the patients who are the most ready for change, and they've had months to sit on it. So patients are much more ready for change than your average population. So I will say that. But just having that amount of time and time to ruminate on it. Even if you're a patient in your standard American diet, you have no idea, like I was back in 2016. If I booked here to stay and I had a few months to think about it, maybe I would become more ripe for change. So there's that. But there are still patients who sometimes I find contraband. I have to say, politely have to say, I'm sorry, but that is contraband. You cannot have that.
And so I was going to ask how you handle that.
Actually, that's my favorite part of the job. There's nowhere else on earth that I can go to someone and tell them that their SOS item is contraband. So I just politely say, I'm sorry. But this is basically, it's a food addiction rehab. The processed food in our world, whether the vegan plant, the processed vegan food or the processed any food, whether it includes animal or not, it's all addictive in nature and it's designed that way. And this is a food addiction rehab. Just as if you were to remove someone from drinking alcohol or using tobacco, which we have an alcohol withdrawal scale that we're always monitoring patients who come in who having had an alcohol intake history. We also have a new policy that I think will go into effect, that anyone who has a nicotine history will be required to start using gum prior to their arrival.
Interesting,
to help reduce that to better figure out dosage and such.
Right.
But anyway, that's how I saw it. And to answer your question, but yeah, there's still some patients who will have a hard time, and they'll talk about eating their yogurt or their meat, or they'll talk about. Usually, most people don't talk about processed vegan foods, but you'll find it when they have an item because they sneak it into almost everything. So when patients, it is a little difficult. We give documents at the beginning of their stay for education. We have 1 to 3 lectures every single day by someone on our staff, or even sometimes we have interns. So like now we have Dr. Clapper with us. He's doing some lectures while he's here. So they have enormous amounts of education while they're here. I will say that I've seen the majority of many patients do not succeed when they go home because time wasn't invested into their environment to change it for success.
Do you help them with that or no?
True North offers coaching support for all patients after they leave. And I think that patients should more utilize that option.
Right.
I think that would help them. So I hope that becomes more emphasized soon. But yeah, that is a problem, and that's where I have some ideas in the future to help with that.
That would be awesome. How do you think that compares with what results you might have seen back in New Jersey? Of course, that was also probably a clinic where people were drawn to that if they valued where their food came from, what was put on their food or not. So maybe people were drawn to that kind of clinic anyway. But can you or tell us about that experience? Any patient success from there, or how you function there?
At Ethos, there wasn't too much of wait time, but the cost was a significant barrier to patients. And again, the problem with our health system, it's a sick care system, not healthcare system. So oftentimes providers have to go out of the system and just do cash, and the equivalent is quite expensive versus seeing many patients within an hour and giving each one just 10 minutes versus giving one patient a full hour. So that's what happens at Ethos. That's why it is expensive. But because of that expense, I think it does make patients put skin in the game, and they're more invested. So that way they're a little tied into it, less than being able just to start like, I quit. But when if you put in thousands of dollars, then you're more likely to try it to the end. As far as success rates at Ethos, actually, it's quite high. The patients at Ethos, they would go through a screening process when they have the intake with Dr. Ron Weiss or myself. And then we decide, do we think that they're going to do well or not? And then sometimes if we don't think so, then they'll say, okay, they're just going to see me and not be an intensive lifestyle program. Or if we think that they will be a good candidate and they already came in reading some books on lifestyle medicine, or then maybe we'll say, okay, I think they're ready to go into the program. Then they're admitted kind of into the intensive lifestyle program. And one thing that's great about that program is, like here where I work at True North, it's inpatient. So patients come and travel to us from all states, even abroad. And at Ethos, that was a local. So patients were already living in their home and they're being trained to eat the raw leafy greens and the berries and whatever the other details of the program. And they're doing that from home. So patients are figuring out how to make it happen in their everyday life almost. So I think the success rate is a bit higher, maybe for that reason. And patients do really well on the first day at the time when I worked there, they called it the 30-day detox. And on the first day, most of the time, patients came off all of their meds on the first day, with some exceptions. And sometimes we maybe had a taper, or some you just like antipsychotics to keep them on. But yeah, tremendous success. And patients stayed off their meds even to the end of their 30-day intensive program.
That's amazing.
It was.
What I want to do, we have all kinds of questions about what tools and resources do you use. Your situation, your experiences are a little bit different than your standard mainstream.
Although I was a dialysis nurse for a few years, so I've seen the end result of not making positive lifestyle changes. It's so sad to think about. Every single dialysis patient I ever had, most of them didn't have to be there, and I feel so sick to my stomach that happened. So anyway, so I do now. I feel very good about it.
Yeah. And maybe more people need to know this information, right? But
oh, yes.
But generally speaking, when it comes to nursing, so I'm going to hand it over to Deborah, because Deborah, if you have any questions up to this point that you want to ask, something that maybe I missed and you thought of while he was talking, and then just to maybe bring into the conversation the Future of Nursing report and things like that.
Thank you. We could spend so much time just digging in on each of these amazing locations that you had these experiences in, both Ethos with witnessing these transformations, and now at True North. And as you shared, coming into it from the dialysis setting, it really a powerful kind of trilogy there to see end-stage renal disease, and then the not miracles, just what should be happening, right?
Yeah, exactly.
It shouldn't be seen that way, but yeah.
Totally. But to the average patient, it is a miracle. Yeah. And all these patients with hypertension and type 2 diabetes or even pre-diabetes, they do not need to have those. They can be it's predictably reversible. I've seen it every time.
Yeah.
And it doesn't need to progress into end-stage renal disease. And sometimes
it's interesting because I just talked to someone high up in my standard issue medical practice who said that I don't know about that lifestyle stuff. You guys are saying things are reversed, but it just can't be reversed. Stuff is genetic and that's it.
I know, and that's the way, you know what? That is being educated to all patients. So all patients come to me saying the same thing. And then I get to tell them one of my other favorite quotes by Dr. Caldwell Esselstyn, who wrote How to Prevent and Reverse Heart Disease. And was one of the first 2 physicians to publish his work that you could reverse coronary artery disease. My other favorite quote is, genetics load the gun, but lifestyle is what pulls the trigger. And that's what all these patients need to be told. And my favorite word is epigenetics, the ability to turn off and turn on genes, turning off the bad ones and turning on the good ones, which was published, I believe, for the first time by Dr. Dean Ornish in the Gemini study. There's the gene expression modulation by intervention with nutrition and lifestyle. That's my favorite research study. If people have favorite research studies, that's mine.
That's a great one. I can always picture that heat map.
Yeah, it was called gene mapping. Yeah, and you could expose the different genes, whether they're being turned off or on. Incredible. They use green and red, which is cool.
It's also exciting, and I believe that we can get our patients and the public, just as nurses, we're so lucky because our patients are an individual, a family, a community, and literally the world, according to our code of ethics.
Yes.
So we can get everybody excited about things like epigenetics. Yes. Maybe we can do a little bit of a dive into a couple of areas, Nathaniel. We'd really love to check in with you about a few things. I'm going to read a little paragraph here that I just came upon from a nursing school in Ohio State University. They're doing some cutting edge things with primary care, and Susie and I love being the opportunity to be providers, but we're passionate about the role of nurses. This says that RNs comprise the largest healthcare profession in the United States. A redesign of nursing education and clinical experiences will propel how a transformed healthcare system meets the changing needs of our population. Undergraduate RN education should focus on the RN practicing at the top of their scope. Indeed, all members of the healthcare team must practice at the top of scope in order to satisfy the healthcare needs and fill the care gaps in our diverse communities. This includes RNs who can help coordinate patient care that addresses complex care management and preventive measures for optimal levels of health. The new design will also enable RNs in primary care to help meet unmet demand in the management of chronic disease, behavioral health care, and the overwhelming impact of the opioid epidemic. And let me just read that again. Enable RNs in primary care to help meet unmet demand in the management of chronic disease, behavioral health care, and the overwhelming impact of the opioid epidemic. So we're coming to understand that the scope of nursing practice is fairly much expands to what the nurse's education is.
Yes. And, and even skills they learn after the fact.
Yes. So whether you're just by being a nurse, you're not initially equipped to put in central lines, but you can. So we would love to explore this with you because we know that you love to find out what can we do? What are the possibilities? You love to imagine.
We have to. Yes.
So can we imagine this with you? And we know that you were also in touch with the California Nursing Association about scope of practice.
Yes.
So can we just start to share?
Let's dive into a couple of things. Yes. Number one, I want to share. I have 3 things to say. So the first one, at my work, we're launching a new research study in partnership with Kaiser Permanente. Big deal. And there's going to be some collaboration going on with water fasting and publishing the data. And we are going to look into doing CIMT ultrasounds, the carotid intima-medial thickness ultrasounds, assessing for atherosclerotic disease, and even maybe watching for a reversal. Who knows? So I was looking into that because I didn't know. I was never trained in it. So then I had to do this huge inquiry. And it took so many emails and calls. But finally, I found out with the California Board of Nursing that nurses and NPs, as long as they are trained, evaluated, and deemed competent, along with a set standard procedures for whatever the skill is, there's no cap to what a nurse, the RN, or the APN can do, essentially. But for my specific request to do CIMT ultrasounds, that's the answer I got. So we are proceeding. So it's super exciting. And the same thing goes with lifestyle medicine, of course. You learn lifestyle medicine, you can, as long as those things occur, that's what certification's for, to know that someone's been trained in it. So that's one thing I wanted to say. Trying to think what the other thing was. Oh, and then that was the Ohio State University, you said? Wow, great. I wonder if they're in touch with the National Health Association, because they should collaborate with each other. Maybe we can make that happen. See? Okay, we can do that. And then the other thing is, when they said management of chronic diseases, is that what they said? I would challenge them to say the management and even reversal of chronic diseases. That's what they should change their verbiage to. And maybe the ACLM could reach out.
So let's deep dive into RNs. Let's think back to RNs, because we are advanced practice RNs. So we do have the ability to prescribe, but as RNs, which we always will be, also have our RN and our nursing foundation, looking at the scope of practice of nurses. Can you share about what you've seen out there, what your experience was before, and with your passion for envisioning what can be possibilities and breaking down barriers and connecting, very much about connecting. You really make connections. Can you share your thoughts about that statement? About nurses with management of chronic disease, behavioral health, things like that. Yes, literally.
Nurses are perfect. We are the backbone of our health system, and we do everything. So I think it would just make sense for us being added with a new skill of learning lifestyle medicine and educating patients that they have an option to potentially, I'm going to say reverse many problems by using lifestyle as medicine. And I think that's one big problem in our health system, is that patients are almost never fully informed. And that devastates me. It's like my dialysis patients or the chronic kidney disease patients that I've seen. They were never fully informed that they could stop the progression of the CKD into full-blown end-stage disease. Yeah, nurses can be a huge part in fully informing patients. And I think when that happens, I think we underestimate what patients are willing to do. I think it's just a matter of them not having the right information, and maybe even not delivered in the right way. Or there's so many things that can influence it. But I think those are a few of the things that I think. So if nurses were trained in this and they fully inform patients, I think we would see a whole lot of change in patient choices. And I think we would see a decline in chronic diseases probably.
That's really a powerful one, just thinking about, and that is one of the callings in our code. It's a very key one, that in order for a patient to make a decision, that patient needs the information. And our role is to make sure that they have the information they need to make a fully informed decision. So that foundational pillar of our code is really key there. So we get informed, and then we inform our patients, and we start to change the world.
And it's part of the nursing process and the implementation phase. And that's part of patient education.
Can I also ask you, we're all in lifestyle medicine and we're passionate about it. And the College of Lifestyle Medicine is an amazing place with passionate clinicians in all aspects, from the physicians, dietitians, nurses, and more. Another group passionate about all of this is the National Academy of Medicine, the Committee for the Future of Medicine. And if I could just reflect with you for a minute. So the National Academy of Medicine, their latest report, and they've had a series, their latest, The Future of Medicine 2020-2030, is informed by COVID and what it's shown a light on in terms of social determinants of health. It's called Charting a Path to Achieve Health Equity. Nurses are trusted bridge builders who champion good health for all. The Future of Nursing 2020-2030 report explores how we can and must unleash the power of the nurse to achieve health equity, and how the systems nurses function within must do more to educate, pay, employ, and enable nurses to support them so they can do more. Wondered if we could reflect now on two groups of passionate clinicians, nurses, they're physicians on that committee, standing up the power of nurses and the intersection of this. And as nurses working really in this space in particular of lifestyle medicine, can you imagine some things that we can and should be doing to bring these groups together and merge these and almost like the 1 + 1 = 4?
Yeah, that's amazing what the National Academy of Medicine put out. I'm really impressed. Did Carla Rodriguez have anything to do with that?
I don't think she was on the committee.
Oh, okay. I wouldn't be surprised, but okay. Wow, that's impressive. Hopefully, that'd be great if they could collaborate. That's one of my other biggest pet peeves, is to join people in communities so people and groups aren't doing the same work duplicatively. Instead of joining what each one has already and moving even further and forward. So that'd be great if there was some sort of, they already do that with health systems, the Health Systems Council within the ACLM. So that's impressive. But yeah, there should be another one with organizations that are going in this direction to all join together.
Wow, that's beautiful. I wonder about reaching out, connecting at that level. We're working to connect at this level of these conversations, nurses' voices, and nurses in action, but thinking about taking a step up to that health systems and that committee. Okay, Nathaniel,
right.
We can always count on you to brainstorm on all these great ideas. And yes, you so much. Go ahead.
I wanted to say that my past spouse, Dr. Ron Weiss, he gave me some compliments sometimes. And one of the compliments that he told me was, I have chutzpah, I think is what he called it. I don't mind chutzpah. Yeah, that's it. I have what it takes to, if it's really needed, I'm willing to do it, even if it makes you uncomfortable, but I try to do it in a nice way. But yeah, I'm sorry to interrupt you.
No, that's okay. Yeah.
I think as nurses, I just want to make one comment, which we all know, but when we're speaking to, but when you're a nurse, my experience has been when you get out and you're a nurse, you're just trying to survive the day and have everybody alive at the end, right? And as you go through time and you gain experience, your horizons get broader and bigger.
They do.
And then you can become those systems thinkers. Maybe you do that at the beginning also, but I really do feel with some time and experience that all of us are at different phases of our career and life, and to acknowledge where we are and to look forward also. We need people doing all these different things because we all have different gifts and talents that we can bring the world.
Yeah. Maybe, Deborah, a starting place, because what I said, that's like a long-term goal maybe. Perhaps a short-term goal would be maybe ACLM becoming an official sponsor of those health conferences, so that they're shown on the thing that they're sponsoring. Then the National Academy of Medicine or the Ohio State, if they're abiding by what they wrote, and then by that, then maybe that could start some collaboration of some kind.
That's great. I know ACLM is really passionate now about outreach and connecting, and one amazing tool is that Intro to Lifestyle Medicine, the 5.5 CME. So that's a powerful one that we can offer out to Ohio State or to all the colleagues at the Committee for the Future of Medicine. So that's very exciting. And it is really a key one of many key strategies is that building connections, building networks. And
and even having maybe a speaker at each one, an official ACLM speaker at each of those would be pretty nice. And maybe even inviting the ones who made those comments, or if those comments were made by a committee, I guess it'd be harder, but maybe inviting some individuals who were behind those comments to ACLM to speak too.
Yeah, those are committee. It's a committee, like a white paper. It's a HEMOC report, and that's the result. And it is a committee, but that sounds wonderful, like direct outreach and in warm invitations.
Yeah. If you send me an invitation, Deborah, I would come.
Thank you. Well, you came to our.
See, it's proof.
I'm going to ask another question here, and then I want to turn it back over to Susie. But Nathaniel, you have a nursing Facebook group where you've connected with an awful lot of nurses, and this is one of your gifts and skills is connecting with people and talking to people. You've gone into people's kitchens, nurses' kitchens, and you've completely rehabbed them, basically kitchen makeovers. Can you share with us? So one of the issues for nurses is nurse health, self-care and nurse health. And as Susie so aptly described, it's making it through the day and getting everybody's still alive at the end of the day. And we all know what the obstacles are there, especially in the acute care setting. Can you share with us some of the things that you feel could move the needle for the nurse, especially those nurses that are in that acute care setting? They're working these long shifts. They've got family, they've got kids, all of that. And then to think about advocacy and working in doing something extra in the community, or even eating healthy. I can remember the best thing I could do was grab those donuts that the latest family left in the break room, and I was back out the door. And that was all I could do. And then the Sprite when I was working my later shifts. We've all, I think, been there. So can you share some of the ways that you feel that we can help, support, reach nurses with actionable education on how they can implement this in their lives, learn about lifestyle medicine, find the bandwidth for it, be moved by it, where they can be implementing some of it in their own life? And yeah.
So for starters, when you're a nurse and you're in an official health system, use that as a resource. Health systems love nurses who continue to get certified and getting new skills. The problem is, though, now that baccalaureate nurses are no longer being able to get certified. Is that correct? I believe in lifestyle medicine. So I guess that won't work for bachelor level.
Oh, you're thinking of the certificate itself,
Yes, getting as a diplomat of the college. So I guess that idea.
And Nathaniel, let me just do a redirect here. Let me also make sure that I made it clear when I explained it or asked that question. Can you especially talk to on a personal level? You have so many personal relationships with nurses. Keep in touch with so many. From their stories of what brought them to this, what you've done helping other nurses and how you connect with people, what are some of the ways that we can reach nurses that are already so stretched and struggle to have the bandwidth for another thing on their plate, including a new plate of food, a new type of food? Can you share with us about that from all these personal relationships that you have?
Probably my biggest tip to busy nurses who want to implement this in their own lives and who are very busy, I would say, if making food does take time, and there's now some options out there where you can actually order outside and have it shipped to your home. And like True North Health, we now have an official pamphlet of businesses that we endorse and are part of our affiliate program, like Whole Harvest. Now I believe there's a button to click for SOS Free. And we have some other ones. I'd have to look it up. But that would be an example of a busy nurse to go ahead and maybe buy something like that and have it in their freezer, and maybe even put it into their freezer at work. And that way, whenever they're at work, boom, they got a meal ready to go. Work stress-free. And that's a way they could implement some lifestyle medicine in their everyday busy work life. I know that the American Holistic Nursing Association, the AHNA, they publish regular materials for nurses to do for self-care. And sometimes whenever I hear about essential oils, I would think, I don't know about that. But when I came here at True North, we have naturopathic doctors that I work with, and we have some problems like headaches or nausea. Again, this is in the fasting environment, but we would give them peppermint oil, and I am shocked. Most of the time it works by sniffing some peppermint essential oil. So now I changed my mind. So now whenever the HNA publishes stuff, I do like it. So they publish resources to read for self-care that I highly recommend. And of course, the ACLM I know has at least one self-care handout, I believe. But other tips, I would say, like, we could just address each pillar of lifestyle medicine. So we touched on the food one. Another option is on the night before work or on the way to work, if you know of a store where you can go grab some produce, just go grab some produce. Go grab your fruit. Go grab some veggies. And if you're able to have an instant pressure cooker, maybe even at work, you can have a thing of dry beans ready to go. And you can just put some and make an instant pot recipe at the beginning of your shift to throw in 3 things, poof, click. And then by the time your lunch comes around, you can have a lunch ready to go. And I'm sure your coworkers would appreciate it and the smell. So that's an idea. Okay, so those are the food ones. For the stress management, and it's interesting because I've adopted this way since being a registered nurse. So I haven't had the opportunity to implement this in my own nursing career as a bedside nurse. But now I'm talking about it, it's actually fun to talk about. Some other ideas like for stress management, downloading an app like Headspace or a free one's called Insight Timer, and maybe just doing 5 minutes when you get your small 30-minute break. Maybe I would start with that first and then eat your meal so you can eat a little bit more relaxed than you otherwise would have. As far as exercise, I think everyone's moving enough in nursing. Although, as you see me here, I am walking while I'm on this call, and I no longer sit and do computer work because as a lifestyle medicine certified professional, they have us do 3 lifestyle medicine related articles each year to keep our renewal and keep active. And one of them was talking about how sitting, it contributes to all-cause mortality, regardless if you make it to the gym all the time. So that's why I cut out the sitting as much as I can. So that's why I'm walking. So I think same thing goes with bedside nurses. If they can somehow figure out how to make these if the administration can help nurses and maybe even have a stand-up desk station for all their computers. I know at my first inpatient job in the cardiac step-down floor, we actually had 2 chairs that were stand-up. You could. So I would have done, so if I continued to work there, I would probably stay there. I probably wouldn't be able to get a walking treadmill. That might be too much unless someone was able to figure something out. But so that's another option to reduce sitting because that contributes to dying early. So who wants that? That's what all these pillars of lifestyle medicine are. They're all there because they were shown that if you don't do them, you'll live a shorter life and those years will likely be low quality that you do have towards the end. So we touched the food, we touched the activity, we touched the stress management, the substances. I don't think that's really too relatable at work, but of course using PPE, let's see, sleep, that's outside the workplace, but really structuring your day and making sure that you're going to get a minimum of 7 hours of sleep every night and dedicating 7 hours saying, nope, I'm home and I'm in bed from this time to this time. And that should, go ahead.
I'll say I can make a comment about the substances, which is a lot of us are very stressed out. And then we go home. I used to get off my night shift, go to the diner, get eggs and bacon and grits and potatoes and a beer,
right,
and then eat, and then go to sleep. We really could. I could have definitely had some improvement in my life at that point. So it's a high stress, emotionally and physically jobs. There are some people nowadays, we've normalized alcohol intake so much. So I do think that's an issue.
Oh, sure.
Can be, right.
Oh, for
right.
sure. As far as the alcohol is concerned, sure, absolutely. I also think that if someone sets their environment, they have all the food ready to go at their work and they're no longer hungry the rest of their day, then they're probably less likely to do binge eating after work. And some of that stress management and the less sitting will also probably help negate one wanting a substance to increase dopamine and to feel better. So that's something else. Yeah. So the sleep we talked about, and in the positive social connection, you're at your place of employment, you'll always have coworkers. So trying to make positive connections, and if there's ever negative emotions, trying to speak up and say, hey, I want to have a positive relationship with you or whoever it is, and always trying to be positive and work through. So I think I hit each pillar, some applicable ways for nurses to use in their everyday busy lives. But I was mentioning the certification earlier because I was going to say they're part of a health system. They can use it as a resource to help fund such a thing. Because like myself, I haven't had that opportunity because I'm not in the conventional health system. I don't have access to such a resource.
Deborah, maybe you could clarify what will be available for BSN levels.
Yes, there will be a certificate, but it won't be the exam, the certification exam. But that's actually a win because there are certificate programs are really growing for nurses and lots of health professionals, and it will be very affordable. ACLM will be able to control what it costs for nurses and others to take it. And therefore, just like with the free 5.5 free CME, rather than being linked to the board, and that's the ABLM and the IBLM, and that is a set price, this can be in the couple of hundreds of dollars. And yes, it can be very accessible, very affordable. And then just as we're saying, we want all nurses to be empowered to practice at the top of their scope. This will really put us in the position to launch this everywhere. And so it is a win for nurses. And then there are other, we're seeing there are other certificate courses being offered, like the diabetes course. So I think that this is a direction that we're going for a lot of this education, an intensive course for different things. And I think that it'll be interesting for ACLM and others, nursing organizations, and all of us to give voice to the fact that I think these represent, when you said, Nathaniel, if you have the education and you've proven it, and then so the interesting thing with this, it will be a certificate, and hopefully some Q&A that goes along with it, just like for a lot of the CME. I think that's a really interesting aspect. So that way it's proof. I went through the course. I've proven that I'm competent, and then going out with that. I think given your conversation with the California Board of Nursing, that will be an interesting one, an important one to talk about. I'm sure the content will be stellar. But beyond that, just like in a course at university, we get a grade. It says you did it, you didn't do it, you were able to demonstrate proficiency. So I think that'll be interesting. I don't know more about it, but we'll have to stay tuned. And it does make me want to circle back about that aspect. That's a really good question, Susie. Yeah.
I have something else. You made me think, actually, you can still use your resources if you're in major health systems to help fund you for reimbursing you for CME. If you as a nurse, you can choose any CME typically that you want, as long as it's accredited, and you could use those funds for ACLM CME. So actually, let's take everything back I said about that. There you go. That's a huge positive. And also, I wanted to ask both of you, since you're doing these great interviews with all of us lifestyle nurses, lifestyle nurse NPs, are you two ever going to consider doing a podcast? Because we're waiting.
A podcast about lifestyle nursing?
Yes, a first ever lifestyle nursing podcast. And you two are perfect. Deborah.
What do you think, Deborah?
I think we would definitely be game for something like that. We're going to have a YouTube channel, and Susie already has a beautiful podcast that she was doing about lifestyle. But it is really fascinating to think about, really, rather than, there's the one aspect of interviewing lifestyle medicine professionals, but there's the other aspect of really moving this needle by focusing on nursing. And the more we start to unfurl the little petals of this, the more we just say, oh my gosh, there's so much amazing work being done out there by nurses and supporters of nurses. We've just scratched the tiny little surface here. And so we're pretty excited about that.
And you'll discover so many nurses that are probably doing so many great things, like you say. I probably have no idea of all the great things that nurses are doing. So I think an app would be phenomenal. I'm sorry, a podcast I meant. When I think of podcast, I think of going on my phone looking for an app. But yeah, that would be amazing if you both did that. And I love, Susie, that you already have your podcast going. So hence, I think it'd be a more perfect duo to do it. That's what I think. So you have my vote. If I can help
we'll put it on the list.
If you need any help, I'm happy to help. And also, I wanted to backtrack when you're making positive changes, promoting positive changes for patients or even fellow nursing comrades. Something that's really important is making sure that it comes across in an appealing way, not as a negative, but as appealing. So showing that by doing this, let's say you go buy the healthy foods ready to go in your freezer, for example, make it sound appealing. Like you're actually going to have less worry time about buying unhealthy foods before or after, or even buying the unhealthy food at your hospital cafeteria. To make it sound appealing, you get access
to it. You're preparing for it.
Yeah. So Susie, okay, podcast time. Live, what do you want to call it?
I'm going to apologize.
Oh, there's baby.
Oh, we got a baby. Oh,
Look,
who's
isn't he
that?
cute?
Who's that cutie?
Oh my gosh,
Who
he's
is
so
he?
cute.
Who's that handsome stuff?
That is Ernie. That was he's 5.5 months. I apologize.
Wow. Cute.
He's really
Thank
cute.
you.
Nice.
My son had a little emergency meeting, came out, and
Oh, okay.
this little guy was asleep,
Okay.
but now he woke up. So playing to your strengths again, you are really unafraid to reach out to people and really boldly go where no one has gone before and throw out ideas and say, hey, what about this? What about that? Can you share with us some ideas about where you think we, number one, Susie and I should be reaching some people to talk to? And then also, can you share from your experiences with nurses who are feeling that they could be doing more with their patients, that they would like to do more with their scope of practice within a setting, how they can reach, what some of your strategies are for that? Because one of the things we're going to do is we're going to put together some sheets that are like assets to go along with this in addition to the YouTube. And that would be little nuggets and gems from the nurses that we're interviewing with and other colleagues of nurses about how do you go about making change in an organization? How do you get colleagues on board and including people that are in much higher positions?
The number one answer to me is by being a living example. That is the number one way. And sharing the positive experiences that you've had. So, like for me, I could say, I no longer have asthma symptoms. My asthma is now considered mild. And again, I'm asymptomatic. Huge improvement. My whole life revolved around severe asthma. So, holy smokes, people, listen to me. And plus, I'm living the way I practice this way all the time. So, I think that's the first step. And then a second step would be by using yourself as an example. Your coworkers will see that, and maybe they'll bring up discussions. And I think that there is strength in numbers. So if other nurses start tuning in, they're like, I'll have to think about it or whatever. And then you help, and then maybe that initial nurse would kind of function in a way as a coach, as a mentor to other nurses on the floor. And I think that's how it should start. And then once multiple nurses are on board and they're doing it and they all experience great improvements in their own health, then when there's enough nurses, like I said, then it just keeps growing and growing on its own in a way without forcing administration or doing anything too abruptly. But I think that's the way to go and way to start.
Susie, I'm going to just jump in with one little personal aside too about Nathaniel. Nathaniel, you also really connect. You're very generous in your heart. And one of the things that you do is you connect people with one another, and you're always looking for ways to help this person or that person or that organization. How many times, I'm going to connect you with Deborah and she can. And so you build this beautiful web of people that are connected, and that it's one way that you offer yourself to the world and to show an example beyond just living the food and the lifestyle is that living that.
Once you get all these benefits, you just want to share it with others. And I love doing that. And I love sharing resources with other people who need it. Deborah, you're an expert with so many things, but including preparing one to take the boards for certification in lifestyle medicine. And as soon as I hear someone say, Nathaniel, I need help preparing for the boards, I say, never worry. We have Deborah's phone number. But that's an example, of course. I love sharing. And so, you know what? It's like lifestyle medicine. You want to get your biggest bang for your buck. And with resources, there's just many little resources and they pay off in dividends later. Like by me sharing something with you to get access to help preparing for the boards, that'll help them to motivate them and may likely have a higher chance of passing the boards. And they're going to affect so many people, more people probably after they get that. And I love it. I really do enjoy it. And I love you also are very, very kind and generous yourself with all the time that you devote to this as well. And both of you and Susie as well. So I think it goes all the way around. And we're all grateful for what you both do.
You guys are superstars.
And Susie too.
I'm just coming along for the ride.
We're a constant.
Susie is same, yeah.
And every time that I come across something where I see a connection needed, I do it right away. And I do that in all aspects of my life. Like something's needed, let's say I'm talking to someone, and I mentioned something or they mentioned something to me, I like to do it right away. Because if I wait, I'll forget about it. So I do everything in the moment as soon as I know about it. So as soon as the conversation comes up, let me connect you with Deborah. Here she is. Boom, set. Taken care of. You're set for life.
Set for life. Just know, Deborah, you'll be set for life.
Best resource I got.
All right. Nathaniel, thank you so much for spending time with us. Anything that we haven't talked about you think listeners would need to know?
Did you get your greens in today?
That's a good one. That's a good one to end on. Thank you so much.
Bye, ladies.